Well, let's get you more perspective now on vaccine hesitancy. Rupali Limaye joins us live now via Skype. She's the Director of Behavioral and Implementation Science in the International Vaccine Access Center at the Johns Hopkins Bloomberg School of Public Health. Thank you for speaking to us.
Thanks for having me.
So first of all, give us an idea of how the level of reluctance to taking the vaccine in the US has really changed since the vaccines were first approved late last year.
So we've been tracking vaccine sentiment for about the last year, and starting in March, we started to see a bit of a decline with regards to willingness to accept a vaccine. What we have seen is there has been a pronounced difference with regards to less women are likely to take the vaccine or have intentions of taking the vaccine. And of course, Blacks and Hispanics are even less likelier to take the vaccine. And so there has been a steady decline starting from March until the end of the year. At the end of the year, the vaccine started rolling out. We were very hopeful that those numbers would start to increase, but we're still seeing some pockets of hesitancy, even among our healthcare workers that are still getting the vaccine in a lot of states.
And what is the main reason that people really give for having this hesitancy?
They're multifaceted and they're complex, but really they boil down to an issue of trust. People don't trust the process. They feel as though that perhaps the process itself was tainted, that it was expedited, even though it went through a robust, rigorous safety and efficacy process. Individuals feel as though that it was rushed through. And then in addition to that, it's a new product. So we're going to see that no matter what. Anytime a new vaccine comes out, we tend to have some hesitation at the beginning because people want to see how their friends or family are reacting to the vaccine before accepting it. The difference here is that we're in the middle of a pandemic. And so it's really important for us to persuade people and talk to people and really be transparent about what the vaccine can do for you so that they can make an informed decision.
Now, for some people, it's about the newness of this vaccine, but for others, there's a long-standing mistrust when it comes to the medical community. What do you think it's going to take to change their minds?
A lot of it has to do with transparency and having empathy. I think that there are groups in this country that have historically dealt with trauma related to medical experimentation. That has never been resolved. The other issue is that we're living in a very uncertain time. And so I think it's very important for those of us that work in public health, whether that be doctors or nurses or public health practitioners, that we're empathetic and that we're able to talk to people about their concerns and not be dismissive of their concerns. That's the only way that we're going to be able to talk to families and let them know why it's important for them to get the vaccine, not only to protect themselves, but to protect their family and their communities.
So in your opinion, then, who do you think African Americans specifically need to hear from to change their opinions?
I think there's been a bit of an undermining, I would say, of the health system because of what has happened in terms of this COVID pandemic and the way that it has been managed here in the United States. It's important to identify other community level influences that African Americans trust. So that could be a community group leader, that could be a religious individual, a religious leader. So I think it's important to think about who those spokespeople will be, and they might not be public health or doctors, and that's important to think about. And we have to make sure that we advocate for different influencers to talk about the vaccine so that we can make sure other groups are feeling more comfortable.
Now, I do want to distinguish between being vaccine hesitant versus being an anti-vaxxer. What are anti-vaxxers claiming, and how is the misinformation being addressed?
Yeah, so I think about vaccine behaviors on a continuum. So you have people that accept all vaccines, you have people that accept some, you have people that might delay vaccines, or you have people that might accept vaccines but have questions or concerns about that decision. There's a very small proportion of the population that fundamentally and philosophically oppose vaccines, and those are your anti-vaxxers. But the majority of the population, whether that's here in the United States or anywhere else in the world, they are open to being persuaded or nudged in one way or the other. It's just important that we get the right information to them. And as you mentioned, the challenge that we have been facing with regards to hesitancy and intentions is that there has been an exponential increase in misinformation on social media, and people are starting to consume that social media at much higher rates they were pre-pandemic. And so there's a lot of misinformation out there that people are seeing and unfortunately they're believing related to vaccines.
So then, are we seeing similar hesitancy in other parts of the world? And if so, what's driving their reluctance?
It's, I think all over the world, even in more of lower and middle income countries, there are still pockets of hesitancy. I think part of it has to do, again, with the development process. People have concerns that it was developed, the two vaccines that are currently available were developed rapidly. Again, even though they went through strict safety as well as efficacy protocols, there's still concerns about that. The other issue that we're continuing to seeing outside of the United States is that people are saying, well, it's a new vaccine. I don't really want it. The other issue that we're seeing, again, outside of the United States is this idea of risk perception. In most countries around the world, if you would get COVID, again, if you take out sort of the US as well as Italy and a few of the key countries that are continuing to see a huge severity in the types of cases that they're seeing, most countries might be seeing more milder cases, so they might not think that they need the vaccine.
Now, I want to get to this issue of healthcare workers. You mentioned some reluctance on their part, and some of these other essential workers who are reluctant. How likely is it that being vaccinated will be required as a term of their employment, and what are the implications?
It's a real challenge, and it is one way to increase protection in a community. My concern with that, and most of us that work in this space, is that it's very punitive. It also undermines the public health system. This should be a choice. This should be an informed choice. But if you're taking that choice away and you're essentially telling people they have to get the vaccine, you're not really instilling confidence in the healthcare system. And so that is a real challenge. However, on the flip side of that, we know that in specific clinical care settings, those that are in contact and are exposed to patients are required, for example, to get the influenza vaccine. And so there have been discussions at the employer level, not only within healthcare settings, but in settings where there might be occupational risk of exposure, that should employers consider making the vaccine mandatory. And I think, it's very, very tricky to implement something like that and make sure that there's not a backlash. So I think there'll be a lot of discussion around this moving forward.
And just very quickly, do we have any sort of timetable for when Americans will be safe enough to move freely without the masks or the social distancing?
I wish I had a crystal ball to answer that question. A lot of it will depend on how states can quickly allocate and distribute the vaccine so that we have enough people in communities protected so that there aren't enough susceptible hosts for the for the virus to continue to replicate. And so fingers crossed that by the end of the summer that we'll have a large proportion of the population vaccinated, but it's all going to be dependent on allocation and distribution at the state level.
All right. Well, thank you for your great insights. Rupali Limaye there, Director of Behavioral and Implementation Science in the International Vaccine Access Center at the Johns Hopkins Bloomberg School of Public Health.